several experts, as well as the Congressional Budget Office and the Joint Committee on Tax, have estimated that the health insurance tax will result in higher health insurance premiums for individuals and families. Could you please explain why the tax will lead to higher premiums and how the tax is at odds with the ACA's stated goal of making coverage affordable?
The way the tax is designed, the fixed fee, $8 billion, for example, in 2014, is allocated among insurance companies on the basis of market shares. And what that means is that every time you sell another policy, you raise your share and thus raise the tax that you have to pay. That's just like putting a sales tax on insurance. And we know what happens with sales taxes. If at all possible, you try to shift that on to the customer. This is exacerbated in this case by the fact that for the for-profit insurers, those paying corporation income tax, they're not allowed to deduct this tax. So if you've got $1 of premium tax, you actually can't just raise premiums by $1 and come even, because your tax liability is going to go up. So you have to actually raise by $1.54 if you do the arithmetic. That's a real upward pressure on premiums that's built into this tax. And you might like to think maybe it'll magically come out of profits, but these are insurers that operate in competitive capital markets. They don't have excess profits that you can identify. You might want health insurance workers to work for less, but I think we're trying to have workers have their incomes go up, not down, and have more employment. So the net effect of this is by and large going to be higher premiums, and that's going to get shifted on to broadly the middle class.
Okay, thank you. I yield back.